My name is Priscilla Kahn. I am married. I have a son. He's 7 years old. His name is Jameson. I've always wanted to work with babies. I thought originally NICU, but the NICU was a little too much for me, so I thought postpartum. I love working with babies. I love teaching parents how to be parents the first couple of days of those little babies' lives. I think it's super rewarding being a nurse. I love to dance. I love to go out to eat. I love to go see movies with my husband, although he hates going to the movies, but he goes for me. Bar hopping, restaurant hopping, that's my thing. I was seeing an oncologist for a full year, and I got the diagnosis of having cancer at 34. I had already had the diagnosis of HPV, so I knew I was at high risk for developing cancer, so I was seeing a doctor frequently. I did a procedure called LEAP, which is like an electrode that takes off the cancer cells from the cervix, but it didn't work. So then after that was when I was diagnosed with stage 2 cervical cancer. Seeing that diagnosis on paper, on my phone, was like, my mind just went blank. It was in complete shock. Then I had to tell my husband. We were in the middle of a vacation, and then tell my parents when I came back home that night. That was even harder because I'm their only child. So I got a referral to see Dr. Diaz here at the Miami Cancer Institute, which was the best decision of my life.
I'm Dr. John Diaz. I'm the Chief of Gynecologic Oncology here at the Miami Cancer Institute, and will lead Florida's largest team of G1 oncology for the treatment of cancer here in South Florida. There are approximately 16,000 new cases of cervical cancer a year, and these numbers are decreasing across the developed world, in large part thanks to excellent screening programs with Pap smears and HPV screening, as well as the advance we've made with HPV vaccination. But still, 16,000 cases is too many cases in a nation like the United States. One of the benefits here at the Miami Cancer Institute is we have a multidisciplinary approach to patient care. We look at the entire patient in combination with our team of pathologists, radio-oncologists, and radiation therapists to make sure that we provide tailored, individualized therapy. And that was the case with Priscilla. When we looked at her case, she was looking for a surgical consultation. And when we took the bigger picture and were able to present her at our multidisciplinary tumor board, we decided that in her case, actually surgery was not the correct first choice, and that she would be better managed with definitive radiation therapy, which would have the same oncologic benefits, but less toxicities than a multimodality approach for her. She was a younger patient than what we would like to see with this diagnosis. We were able to still catch this at an earlier stage and provide her an opportunity for cure, and that's what we went for, and we're very happy with the outcome that we've had in her treatment.
The team here was amazing at delegating the fast treatment that needed to happen. It's hard to be a patient when you're a nurse. You eventually have to let your guard down. I had to become the patient, not the nurse. I wasn't the caregiver anymore. But the staff here at Miami Cancer Institute was amazing. Anytime I felt bad, there was always someone there to pick up the phone, give me advice, call in a medication for me.
It's so important every year to see your gynecologist and make sure that both you and your gynecologist are aware of your routine cervical cancer screening intervals.
So now for sure I could say I'm disease-free. I was in remission as part of the PET scan in October, so I got to ring the bell. I'm getting back to normal now, start the new year, new me.